Why are more women dying from heart attacks? Do you know your heart attack symptoms? Every minute, a woman dies from heart disease in this country and around the world. It is a little known fact 50% of women will suffer heart issues during the course of their lives. You may not know it, but more women die from heart attacks in America than men. Current research is showing that cardiovascular disease is a greater health issue for women than for men. More women die from heart disease currently by greater margin than men. While heart-related deaths of men have been going down over the past 30 years, the rate for women has been steadily going up, and up. Heart disease is the #1 killer of women and men in the United States. Each year, more than 1 million Americans have heart attacks, and about 500,000 people die from heart disease. Now take a minute and look at the signs of a heart attack for women. They are different than for men. Head, lightheadedness, arms, back, jaw, neck, between shoulders, pain, discomfort, and numbness, chest, pain, pressure, fullness, or squeezing, lasts more than a few minutes or comes and goes. The skin goes into cold sweat. Lungs, trouble breathing, shortness of breath. Stomach upset, urge to throw up. You know, that urge to throw up, you might think it might have something to do with something you ate, but it might be the pressure of your heart. Other signs, in addition, some women may feel very tired, sometimes for days or weeks before a heart attack occurs. Women may also have heartburn, a cough, heart flutters, or lose their appetite. Keep in mind that women do have different physiological differences from men as it comes to heart attacks. You may not be aware of this grim fact. More women die from heart attack than die from breast cancer at all ages. Why aren't we more aware of this discrepancy? The simple answer is that we think of heart disease if something older women suffer, not a young woman in their prime of her life. Unlike cancer, heart attacks gives no warning and happen very quickly with no long goodbyes. You know, no one's talking about the heart attack because it's not like chemotherapy is required and long stays in the hospital and MRIs and all that stuff. If someone has a heart attack, they're gone. The risk of heart disease in women is often underestimated due to the misperception that females are protected against cardiovascular disease. The under-recognition of heart disease and differences in clinical presentation in women lead to less aggressive treatment strategies and lower presentation of women in criminal trials. Cardiovascular disease is a major cause of death in women and is still under-recognized and undertreated. A greater awareness of the differences in representation of angina pectoris and ACS between men and women when gender-based interpretation of diagnostic tests is mandatory for healthcare professionals to improve therapeutic strategies and outcomes in women. Cardiology guidelines should be more focused on sex-related differences when appropriate. Women's heart issues desire the same public awareness as that of breast cancer. Women must have self-awareness of their cardiovascular risk factors and pay more attention, which will result in a better prevention of cardiovascular events. And that's the major thrust of this video, is that women have to have more self-awareness of their cardiovascular risk factors and pay more attention. You know, here in this diagram, we have black women and Latinas heart disease. 6 in 10 women of color do not recognize that heart disease is the biggest threat to their health. 1 in 2 women of color in the United States will die of heart disease. 40% of black women have a 40% likelihood of having heart disease or stroke. 30% of Latinas percent likelihood of having heart disease or stroke. Now look at this chart here of misdiagnosis of women with heart disease can lead to malpractice claims. This is from one of the insurance companies. Heart disease is the leading cause of death in American women, killing 1 in 3, and prompt diagnosis and treatment is crucial for prevention of the adverse events in female heart disease patients. The doctor's company analyzed malpractice claim involving alleged injury and death from cardiac disease in females. The allegations in this claim was misdiagnosis 44%, medical treatment issues 37%, and other issues 19%. But look at that whopping number, 44% misdiagnosed of women's cardiovascular disease. Please subscribe and share this information with all the women in your life. You know, if we don't get the word out and make this aware as much as it's awareness of breast cancer, the breast cancer deaths are going down, but heart problems and heart disease is going up. Please like us on Facebook at Saturday Diet, facebook.com Saturday Diet. Go to joanbars.com to get your free copy of our 10-page weight loss report and Joan Bars recipe. You see here, get access to your free guide now by subscribing to our newsletter. Go to SaturdayDiet.com to review our new low-cost weight loss e-course packages. We have revised our packages. Go over and have a look at SaturdayDiet.com and see how well we have increased the value for you in our low-cost e-course package. We offer 3 packages that will fit any budget. If you really want to lose the weight, we offer this low-cost opportunity for you. Please share this information. Please subscribe. See you on the next video. Bye-bye. Why are more women dying from heart attacks? Do you know your heart attack symptoms? Every minute, a woman dies from heart disease in this country and around the world. It is a little known fact, 50% of women will suffer heart issues during the course of their lives. You may not know it, but more women die from heart attacks in America than men. Current research is showing that cardiovascular disease is a greater health issue for women than for men. More women die from heart disease currently by greater margin than men. While heart-related deaths of men have been going down over the past 30 years,